On India First, our top focus story is this monster COVID surge in the national capital. A record 17,282 cases reported in the past 24 hours. 104 people have lost their lives in the national capital just in the past 24 hours. Compare this to the situation day before yesterday. Cases have shot up from 13,468 to 17,282 just in 24 hours as the national capital reaches the 50,000 mark. Delhi is India's biggest COVID hotspot. News also coming in that Delhi Chief Minister Arvind Kejriwal is to meet the Lieutenant Governor tomorrow at 11. The Health Minister will also be present. And I quickly want to cut across to India Today's Milan Sharma for more on this big story. Also with us is India Today's Ankit Tyagi on this meeting. But Milan, to you first, what explains this sudden surge? Is Delhi testing more, or are more cases now emerging, especially this new variant or new mutant of the virus?
Well, Gaurav, there are all these reasons that you just mentioned. Delhi has witnessed another spike in cases, more than 17,000 being recorded in the last 24 hours. We just saw about 15,000 that were recorded in the previous 24 hours. And the death rate has also increased. Now we have more than 104 deaths. Earlier, there were 81. So certainly the cases are rising. The test positivity rate at this point is more than 15%. And that means that as much as Delhi is testing already, more and more positive cases are coming forward. And that is also a cause of concern, which is why social distancing that is not being followed in many places and people who are not following COVID appropriate behavior are leading to the surge, and which is why beds and hospitals don't have ICU ventilators at this point. We're looking at the people who are getting admitted for serious cases, and some of them are not vaccinated, which is why this crucial meeting also has been called. But Delhi will definitely need to do something like Maharashtra, because at this point, we're looking at a lot of high number of active surge in cases. And after Mumbai, Gaurav, Delhi has now become the new COVID hotspot.
This is a cause for grave concern. Ankit, you spoke to Delhi Chief Minister Arvind Kejriwal. When you look at ground realities in the national capital, if we were to talk about ICU beds with ventilators, 93% occupied. If we were to talk about ICU beds without ventilators, 82% occupied. So the situation does appear to be alarming. What is this meeting all about, Ankit, when the Chief Minister meets the Lieutenant Governor? Are we looking at a lockdown 2.0 even in the national capital, Ankit?
Well, I can't deny that at this moment, Gaurav, because the Chief Minister has also said if the health facilities get overburdened, they will have no option but to impose a lockdown, possibly a little different than what we saw in last year, but there will be more stringent measures that would be coming in as what we are already looking at, measures which are already placed. The night curfew absolutely is not enough. We are heading towards 20,000 cases. Delhi has tested more than 1 lakh people today. That is the highest that they have done so far in one day. But the fact is that the sheer numbers are absolutely overwhelming. As far as the ICU beds are concerned, because 93% were already occupied, the government has now, in fact, extended 187 more beds with ventilators and 718 ICU beds with oxygen facility. As we were speaking, Satyendra Jain has also said that to augment the number of beds which are available, the hotels are now being attached to the hospitals, where the hotels will be completely converted into hospitals, and the hospital which is attached to them would be sending doctors and paramedical staff to take care of the patients. So situation is quite dire as far as Delhi is concerned. And as the Chief Minister warned, if things don't come under control, well, possibly we are looking at more stringent measures, Gaurav.
Stay with me, both of you.